Welcome to the Resilient Performance Podcast. This is Keep It Real number 19 with the boys Doug Kachijian, Trevor Rappa, and myself, Greg Spatz. We're going to be talking, we'll start talking a little bit about the Derek Hansen podcast that Doug did. I think it'll be 2 weeks ago by the time this is released. And just start off there with some of the principles that you guys spoke about. Trevor or Doug, you want to take it and run?
I think I'm gonna unmute myself there. I just think when I think about Derek and the influence like he's just kind of had on us from our own education and clinical perspective is he's always kept things so practical and simple, and like simple is I think is often kind of something that's looked at negatively for keeping things too simple, but he really keeps things so effective and simple and practical from how he coaches, how he progresses athletes. And I think that really comes across so well in the interview that you did with him, Doug. And I think one of the things that I really appreciated about the whole discussion of getting an athlete back to sport after a hamstring injury was this idea that you're essentially just doing whatever they can do that is as close to what they need to be able to do as possible. Meaning for a football player, is kind of some of the examples that you guys use, who has to be able to run in a certain velocity and hit certain positions. After a soft tissue injury, you're going to basically just dial down the intensity and dial down the volume of what you're doing in the rehab setting, but you're still trying to be able to get them to get as close to those qualities as possible. So you're still trying to hit acceleration positions while respecting the biomechanics of what may have caused that athlete's injury. If it was a true upright max velocity position, so if that bothered them, well, then let's keep them more in a little bit of a deeper hip position, more of an acceleration position that doesn't put as much tension on the hamstrings, but still lets them work on some of the qualities that they need to be able to do to get back to sport. So I think like just that idea, because in rehab, I think people often skew way too far away from the skill that the athlete needs to be able to perform, which is then they become detrained and it takes so much longer to get them back to their sport because you lose parts of the skill itself that they need to be able to perform, which then take time to train and get back to. So it's like if you don't sprint for 2 months because of a hamstring injury, or let's say 1 month because of a hamstring injury, and then all of a sudden you're trying to go back to sprint right away, you're going to be detrained in that month. So being able to maintain some of those qualities, even though you are dealing with an injury, and just working with what you have so far and making sure that there's no adverse reactions, are not insanely sore, they don't feel like they're getting worse, things like that. It's like you can continue to kind of push the envelope and get them back to the sport a lot quicker than if you just kind of go with a rest it, wait till it feels better, and then okay, you can jog without pain, and okay, now let's just try sprinting, and you're doing a much better job of kind of like checking all the boxes between walking and sprinting when you kind of go with Derek's approach.
Yeah, and Kaba Tolbert talked about the same thing, and it starts with you have to have what is your template of how you prepare physically for your sport. And I like track and field because there's less variables in terms of like technical and tactical. So it's like in sprinting, who runs the fastest? And yes, there's a technical component to running and to block starts, and even a tactical component to running a race. But there's less elements and less variables than there would be in a team sport. And so most track coaches have a template like, okay, on 1 day of the week we're going to work acceleration, 1 day max velocity, 1 day special endurance, maybe 1 to 2 days of tempo or something more restorative. And so if that template is in place and you have an injured athlete, yes, there are things you might need to do to quote unquote rehabilitate the athlete, but at the same time you're trying to maintain a training effect. And that's where there's this seamless coordination between training and rehab. Like if it's a quote unquote acceleration day, one thing that Kaba talked about and Derek is, okay, like there's that neuromuscular piece where you want to be able to go fast, because even if you're not mimicking the position, 100%, if you get somebody on a bike, let's say with a forward trunk lean, that's going to, without exacerbating symptoms, that's going to mimic an acceleration position. It's going to mimic some of the joint angles, some of the speed. You're not going to have obviously the ground contact times that you would have in sprinting, but it's still better than doing everything slow. And how many people have hurt their hamstrings on a bike? I'm not saying it can't happen, but unless someone has a really, really severe hamstring strain, there's a good chance that they can train with some decent intent and speed on a bike. So maybe, instead of running upright that day, they're on a bike, or maybe instead of running, they're doing step overs. There's always something you can do that mimics the thing that you actually care about. And now that there isn't a place for kind of just, like lower level graded exposure type exercises, but sometimes that's all that we do or people do in our field. And there's, a lot of times like there's this message now, like, okay, the body is so adaptable and resilient and robust. And people like pay lip service to that message, but then even in people that have pain, they're not actually doing that much. So it's one thing to say it, but like if you really believe that, then even when people are quote unquote injured or in pain, there's still a lot that they can do. So how do we, address what we think might be underlying root causes of an injury while also continuing to quote unquote train? That's where I think we can learn a lot from people outside of our field, because our field tends to, even despite that optimistic message now, to pathologize things and diagnose things and find things that are wrong with people. And we've talked about this before. I think that if someone truly has like a structural diagnosis, they shouldn't be seeing a PT anyway. So if they're with us and it's appropriate, then there's probably a lot more that we can do than we think that we can.
That was an interesting point that Derek brought up on the podcast of talking about, or I think you asked him about like looking at someone's imaging related to a hamstring injury, and talked about how he always likes more information because it just gives him, again, more information to possibly make decisions from. But there's times where it doesn't matter. If you have somebody with like a grade 3 hamstring strain, they could still possibly get back to the sport in a week or two. Versus he's like, I've had people with a grade 1 hamstring strain that take longer to recover. And he's basing that off of not the imaging itself, but he's basing it off of this trainable menu that you're talking about, and his progression of activities that he knows he wants to see somebody be able to get through and handle these volumes and handle these intensities before he would say, yeah, you're probably ready to get back to your sport. So I just think like that idea of trying to stay as close as you can to what they need to be able to do, and just being able to modify things from a volume, intensity, position standpoint is such a valuable lesson. And like you just said there, Doug, with like the not just trying to go slow all the time. It's like if people have to go fast, we have to do things that are fast. And a bike is a great way that's low impact, kind of decreases some of the risk involved that you would have with sprinting if somebody's really sore. But that's probably an activity that is going to mimic some of those velocity qualities that like muscular contraction velocity qualities that the athlete needs to be able to have in a safe way that is going to at least, and also kind of build their confidence to know that like I can at least do something that's working hard and making me feel like I'm moving fast, even if it's not that upright actually running on the field or on the track right now. But at least you're keeping them in shape, and you're keeping them doing things, and you're keeping some of those other output and trainable qualities that we're always looking for.
Yeah, definitely. And I think a lot of what you're saying translates to anything in what we do with velocity. Like I think that's going to be like the speed and the velocity of contractions and movements are probably going to be the things that you lose the fastest compared to like your max deadlift or something like that. I know, Cal Dietz would talk about that in triphasic training. So if we're not doing something fast because somebody's on the shelf for 4 weeks, we're doing nothing fast for 4 weeks, and we're doing more like therapy related stuff that, whatever it is on table exercises or therapeutic exercise, if that's all we're doing and there's no speed or velocity element to it, and then they go back to trying to run, it's almost like Kiva was talking about on the podcast, like he's got to get people back into shape almost when they get back to him. So it's like they're not really ready to get ready. So that period of being shelved is really important to not, try and make it look as similar to what, like you said, Doug, his normal training week would look like, and just make fine adjustments to that. But I would agree, it's like whatever the fastest movements that you can do, obviously within reason, within any precautions or indications or contraindications because of your injury, those are the things that you need to be doing to kind of push the envelope and keep progressing, or at least just slow the regression potentially. And I think about that too with a lot of my baseball players that I have. It's like, oh, like you're injured, so now you have to do the throwers 10. And for me, that's like the lowest hanging fruit that like these kids are probably already doing all of those exercises because it's already sort of embedded within the baseball culture. But for me, it's like, all right, are you doing that stuff like check that box, like do that 2 or 3 times a week. Like if you have any questions about it, let me know. But that stuff's so simple and so easy to do that like we don't need to spend time on that. And maybe I'll check someone's technique on it and just be like, all right, like you're good, do this on your own. But other than that, then I'm trying to do things that are a lot faster. I'm not going to have kids out there sprinting and throwing a weighted ball as hard as they can into a net, because I'm just not at that point in they're not at the point in where they can do things like that. But I'm doing things with small med balls where they're trying to move the weight, the small 2.5 pound med ball as fast as they can in a throwing position. And to me, that's going to be way more valuable than just doing like a slow, slowly rehearsed banded exercise. I know we've kind of spoken about that type of approach before, but just all of this stuff kind of brings me back to that. And it's why we probably keep looking outside of therapy when we look for continuing education for ourselves. We're always looking to people like Derek or Kiva, or, I know Doug, you just recently interviewed Boo Schexnader, who I think he's actually the one who's going to be on 2 weeks from today when this is released. But, and I remember like right before you had interviewed Boo, he had this whole like string of tweets come out where he was on fire, and he was just kind of I don't know another way to say it besides like he's kind of trashing like the standard of rehab, and we loved it because it's kind of like where we want to be. We want to be more like Boo. We want to be more like Derek. We want to be more like the people who are functioning at the higher levels, and then just be able to kind of scale it back with more of our rehab centric type stuff, but keep things as fast and as related to the skill as possible.
Yeah, I agree with that. I mean, I think if you can do the stuff on the right end of the continuum, the stuff on the left is actually like kind of easy. Once
I mean, it all just becomes like, it's all just a warm up. It's all, if maybe it has a place because it's just kind of like you said, restorative maybe. You do that stuff like if you haven't been doing it to kind of like work on any patterns maybe that you haven't spent time on because you're not injured, and maybe you need to kind of like, all right, like we have a clean slate, like let's work on some of these lower hanging fruit things that I just don't do because they're boring and dull, but definitely.
Yeah, I think like we talk about, speed in rehab, like it's all relative, right? That could be somebody doing like some kind of extensive plyometric variation, like what like the Altus calls like their rudiment series. Like that might be the most that they can do, but that's fast relative to just doing like glute bridges or lateral band walks. And I'm not saying that those other things you shouldn't be doing. I'm just saying don't neglect the things that look more like training, because we often assume, oh well, it's like they're hurt, so in a couple more weeks they'll be able to train. But like you mentioned, Greg, I mean, if you're not doing the things that look more like your traditional practice, then when they're cleared from rehab, they're going to have to do that stuff again anyway, just to be able to get back and participate normally. So we're just trying to eliminate some of the redundancy and the dead time. And what I think this all boils down to is risk mitigation. And I actually, I want to do a series on this podcast. Like I already have one guest lined up. He's a friend of mine, and he's a professional mountain guide. And he's one of the few people who has a certification at the highest level in guiding on ice, on snow, and on rock. And everything that he does is risk mitigation, because people are basically paying him to have fun and to do dangerous things. But if he gets them hurt or killed, he's going to be out of work, And so again, looking outside of our field, how do people who do risky things make the determination as to like, all right, these people are paying me to have a lot of fun. And most of the time, the more risk that we assume, the more fun they're going to have. It's like skiing, right? Like typically the conditions that are the most fun to ski in are avalanche type conditions. And, a good guy can determine like, all right, like here's a line that's going to be a lot of fun, but it's not going to get us killed. It's like in the military. I mean, the most realistic training would be to train with, have an opposition force and a training force and have them shoot with live bullets at each other. But that's unsafe, right? Like it's realistic, and it would have a high degree of specificity and transfer, but it's dumb, right? So then how do we scale that down and make it where it's like sufficient risk to get an adaptation and a stress response and mimic what we want to do, but without assuming unnecessary risk? And so, yeah, getting people like that. I would love to hear from somebody who is like a compulsive gambler, professional poker player. Like, how have you gambled this long and not gone bust? Because that's what playing poker is. It's calculated risk, right? But I think in rehab, a lot of times, like the easiest thing to do is the safest thing. Just to say, you know what, like we're not going to do provocative things. We're just going to do the lower level things. And then once we do these lower level things, you're out of my hands. You've been rehabbed. Now go to your coach. But if assuming that the coach is somewhat competent, if you're a rehab provider and you send someone to their coach, an athlete to their coach, and like the first day they strain a hamstring, again, assuming that the coach isn't doing ridiculous things, it's not the coach's fault. It's probably your fault as the PT, because you're like, well, it's the coach's job to run that person, and it's not. Like we should be doing things with running athletes that look like running, or at least have, again, the whole specificity thing is a very subjective discussion, but that have some transfer over to running. And in some cases that could be an extensive plyo, in some cases it could be a bike, it could be a step over. But at least if your mind is thinking like, okay, I've got to do something that resembles running. And a lot of times we think, oh, hamstring, we have to just like do hamstring exercises, and that's a part of it. But if it's detached from the thing you care about, then you're leaving a lot of potential on the table, and you're just deferring risk onto somebody else.
Yeah, it kind of reminds me of another podcast you did with Nicole Serdica.
Yeah.
Do you know how to pronounce it?
Serdica.
And she talked about do no harm. That was like a major theme in that episode. And like Keba was saying, what you were just saying, like if you do no harm, quote unquote, like you don't hurt them when they're with you as a physical therapist, you're doing harm, because then they're not ready to go back to do anything that the sport coach or the skill coach would is in their wheelhouse. And then it's like, oh well, I didn't hurt them while they're with me, so it's not my fault.
Yeah, and Keba and Nicole, I mean, they said that yes, do no harm, in the sense that like you don't want to make things worse, but training is implicitly you're sort of harming someone to elicit a response. So then it comes down to like how much harm, right? Like how do you mitigate risk? Too much risk, bad. Too little risk, bad. What's the middle? I mean, a lot of these discussions, again, that's why we share case studies, because in the abstract, everyone's like, oh yeah, find the right amount of risk. And it's just like with some of these things with, closed loop versus open loop, change of direction drills, like no one is for or against any of those things. People are for and against bad coaching and bad rehab. And so again, that's a very subjective, kind of conversation. But we just don't want, it's like one of our, friends and mentors, Ben Hagar, said, he said, don't suck. Like no one likes things and people that suck, right? But I think in principle, almost everybody agrees on what are the things that we should be doing, but how you execute that and how you operationalize that and, from a practical standpoint, implement it, that's the interesting question.
That's what I think Derek was such a great guest, because he goes into some of those details of like what his progression actually is to get back to those activities. It's not just purely kind of abstract. Like he gives some of those distances he wants them to cover, especially how the volume drops substantially as the athlete is each repetition or each run is covering a greater distance, and they're able to achieve a greater velocity. Therefore, the whole volume session needs to drop. I think it's like those kind of discussions that I think people take for granted, that we all kind of know and assume, but it's like until you have someone like Derek, who is super well respected and really knows his stuff, telling you that like this is how he does things. Like again, from like a practical standpoint, I think that's why I appreciate Derek so much, because he is very open with what he actually does and shares those things, like how we share our cases about what do we actually do with clients. Because you're totally right there, like people don't really disagree on a lot of like the fundamental principles of things, but then once you can see somebody's application of those principles not really actually follow what they kind of say and what they actually do. That's why I think we are going to be continuing to kind of push out some of those case studies and to share the things that we actually do with the clients that we work with. That's the only way to be truly transparent about kind of what happens in the actual clinic itself.
Yeah, and I remember like there was a time, it was like a year or two ago, and there was this big social media thing about like the Jefferson curl challenge, and it's like, let's just prove to everyone that like the back is resilient, and we'll just do like selfies of Jefferson curls. It's like the back, the hamstrings, right? But it's like, okay, but if you play a field sport where you have to run, like, yeah, you could do Jefferson curls with like a light weight, but that's still like, that's not risky enough. Like you should do things that look more like running. So maybe that's, the stuff that we talked about, that Derek talked about. But so what do you only have so much risk that you can assume. Like you should put the risk in things that are going to have the highest return. So in the context of like lower back rehab or hamstring rehab, like, is the Jefferson curl the thing that you want to, where you want to assume the risk, or you want to do something that actually does have more carryover and more of a preparatory effect on performance? So, yeah, again, it comes down to like, what are the details and how are you actually implementing this? Because no one disagrees that, like, yes, you don't want to be cavalier and careless, or you don't want to do nothing and have somebody be deconditioned. So it's like, where do you draw those lines? And I think it's why we have those conversations and we try to share case studies, and we encourage other people to do that as well. And it's also why things like Instagram can actually be very telling, because you can see what people allow from an execution standpoint and what people are actually doing, even though it can often be without context. It's like, all right, well, we know that this is like something that somebody values enough, they're putting it on the internet, right? So there's a place for all this stuff.
If that's all we have, we can wrap this one up. Anything else, guys?
No, I think we're good on
All
that.
right, cool. Just a quick note, we're trying to push out more free content related to the Return to Sport course that Trevor put together, and we continue to put together as we speak, all about acceleration and agility. So we're having people opt in to kind of get all of that free content. We've already put out 2 or 3 things that are specific to change of direction and acceleration and speed and agility. So if you are interested in that, definitely hop into our mailing list, and then you'll eventually get some sort of email about it, and you'll be able to access any of the stuff we've already put out, and then anything new that is going forward. And we're planning on releasing a whole bunch of stuff just leading up until the course is released. It should be like end of March that the course is released, something like that. We'll give out a free like sample ACL strength program. We got all sorts of video breakdowns of athletes, real athlete footage, a lot of cool stuff there. So definitely check that out. And then that's all for this week. And we look forward to talking to you again.
Thanks, everybody.
Thank you for listening to the Resilient Performance Podcast. As a thank you for listening, please use promo code PODCAST for 10% off our professional development resources at resilientperformance.com. Also, make sure to sign up for our mailing list to receive exclusive content and promotions.